Yes, subscribe. You always dey watch we program them, but you not subscribe yet to the channel. All wetin you get for do, press this red subscribe button and then you come over here and press this bell. To the bell option, press this one with all. E don done. E no get for cost you anything. When you do this, na sign for show say you dey support we for make we do more. Thank you for we don help we for share this program. Yeah, God bless you. Yes, subscribe. You always dey watch we program them, but you not subscribe yet to the channel. All wetin you get for do, press this red subscribe button and then you come over here and press this bell. To the bell option, press this one with all. E don done. E no get for cost you anything. When you do this, na sign for show say you dey support we for make we do more. Thank you for we don help we for share this program. Yeah, God bless you. All right, good evening and welcome to another edition of your program where we call Weird. My name is Sembepe, the Freedom Fighter. Well, we don't come with something for you. We basically want to look at something because it's like plenty other things they happen where they make like where they tend for forget with actual responsibility or waiting at the real thing where we for look inside. Well, the distraction done so much that we don't they forget usai we come out or usai we suppose for day. Because you know say most of the time the politicians then they determine waiting we for talk. Well, this afternoon I've been telling you say yes, where they take waiting then they give it for talk, but at the same time we not for forget usai we come out and waiting we really want for deal with for the day. So today we don't come basically for talk about this particular thing where now the audit report and specific things them day inside the audit report where we need for look inside, because we find out say the Ministry of Health they spend plenty billions of leons for oversea medical treatment, but the actual side usai dem supposed for pour the money, usai dem supposed for put the money where na the health system, the health sector, they not they get them, especially when you go to the hospital, usai people them, the average Sierra Leone them, they go take treatment, they not they get the money then they, and even when then they say then they put some money then they not they able for account for the money then they at the end of the day. So this now basically waiting we want for look inside this particular evening inside the program today we had. Well, I want to tell you say certain things that they don't come up. The reason why we they look into this again today because we find out say every day we they see picking them where they get a lot of pressure. Every day picking them they come up where they sick. Every day, then they show some signs them where at the end of the day go tell you say this not minor something where we go able for treat, but because of them not get the money, they're not able for get the kind of treatment. We don't see outside picking in food, the bone they rot in, the broke come on ado, the hang na do bone we not supposed for dinner do. They rot in the black param. They get other kind, disease them way it develop, but at the same time, because in people are not able to go and access the health facility, they're not able to get the money. Other thing they happen, past them begin for the bigger now the social media. We don't see different things them they come up. So today we first of all want to start with that ball rolling there. Let we see how it's like for some picking them and where then people them not get money at all. At the end of the day, pass them come again at the social media, also then go end up for say do ya una help me for the sake of God, do ya una help me because of this, because of this, because of this. So let me first of all look into that day and we they come see again because we find out say the health workman them when are they one day where they before for first the COVID where then say the narco vaccine is faithful. For letting us scatter, then don't they strike. Every time we see them they strike. Every day, if they not tell you say then 6 months, then go tell you say 9 months. If they not tell you say 9 months, then go tell you say the 8 or 9 1 year allowance, the risk allowance them, they not they give them. But we find out say they want them where they now the office is them now knock over, then they get their salary. In fact, double. So first of all, let me go back and watch this particular video of them two situations there so of them picking their so as they get medical condition where then they beg the public for let them help them. When they come back just now.
I'm ready for fana. I be for up my my mama name Jatu Kamara. I be for up my no this Anna in the add for swell no more in the swell. I don't know what to make. In the swell no more in the swell. I want make government help me. Any possible plan for help me, when help me, Papa Father, only possibly help me. I go school. Now I know they able to do nothing for this online game. Please help me.
Who say you there?
Watching.
Moribaya section.
Chiefdom.
Samu Chiefdom. Moribaya section. Samu Chiefdom. This now Amadou Fofana in request. They request that government for help them. Good at people for come and help them. But as we don't come here, we self believe that do ya any good at organization, this body suffer. It is suffer very seriously, get a very serious pain. We ask that anybody will be able to come and help Amadou for reach in mama through this line. Call your mama in number. Call your mama in number.
077 57 6462.
Call her again.
077 576462.
This now Amadou Fofana. Ruching Moribaya section. Samu Chiefdom. It asks for request. Thank you very much. Anybody who want to reach Amadou Fofana, he will reach Imama Jatu Kamara through that number we just don't call. Thank you very much.
What is this speaking name?
My name Anna Ikabu.
What's my age?
The age na 3 years.
Emma they go school?
No, Emma not go school yet.
What type Emma they go school?
Now because of this sick way in gets make not go school yet.
But how long Emma don't get this sick?
I don't get this sick now the 1 year this.
1 year this. So Emma no they go school at all.
I no go school.
So as soon as we from the parents of Emma Kagbo don't they suffer from this sick care from a year ago now. So would they beg then sorry heart organization were responsible for them picking their for making go come with aid and help Emma Kagbo for making go gain the health. As una they see Emma enjoy, he don't they suffer for the past 1 year from this joy. They don't the men but still Emma they suffer from this pain here. The jaw just swell para. They don't the men but what thing they just still strong para. So they beg. You know they get a tough as soon as they, they get a tough the play just strong came. So Emma not even able to attend school yet because of what this in health condition here. So they beg then sorry heart organization let them go come with aid and help Emma Kagbo. Any responsible organization we're ready for help, then go contact we at this number 077 55 8451 or 079 03 3335. Emma Kagbo de na roti fun bompechi from a nearby village called Mofona Moyambadi Street. Now that this Emma Kagbo then stay with Imama.
All right, so this is not the situation there right now where they see they go on inside the country. Lots of things them they where we picking them, we find out say then they sick, they're not able to get the necessary medical treatment them where then suppose forget. But at the end of the day, we they find out say the Ministry of Health and Sanitation, the government, the president and in cabinet, then they spend lots of billions them according to the audit report of 2019 and 2020. We will come look inside the audit report there, compare them, let you see how then they mismanage, how then they misuse money in the health sector. But at the same time, we picking them where they cry, where they suffer, they're not able to get the necessary or the basic thing way for make their life, they live their life like young picking them. This na the missing points them where we actually they get and we want for look inside them serious one. Well, if we don't get this, first of all, I'll just give you a number again. Where now the number then down there, where them people also give say now the number there in case you want for assist them. The first one where gets the hand problem, it then a Samu chiefdom. It say in your number na 077976162. 077976162. The second one, when are this young picking again, where in the na woti funk in Macagbo, in your number, I hope I know me Sam 077558451. And the other one na 076033335. So this na the number them we they actually give, say na the number them in case you want for help them. If we get any better health situation, any better health system, well, na the country with equipped, hospital them, we no need for the go through them kind of thing there. So every day the poverty level. So this na the things then when we politicians them always want we for the do, for always believe say waiting and they do to win a favor. Because now if any one of them come, then we begin tell hey, una thank you, God bless una thank you, not knowing that now things where they supposed to put in place for let we save the access and without not even call your neighbor say hey now the problem this one I get to. But now we politicians them they make let the system rubbish every other day. Then the thing that way they supposed to invest in this health system, they not do them. Instead, then they take money in a bag, lots of billions of leons, lots of thousands of dollars, take and go overseas. Say then they go take 100% go spend over $73,000. $150,000 say they go take treatment overseas. Whereas this young picking, if you look in condition, sometimes a 1 million or 2 million case, na in a young case, but because in people them not able to afford them, then they end up for rich to no conclusion, but for come now the public and can begin say, "Dear, una help me for God." Do ya? Then the politicians them sit down. They wait for election time for camp. For pick 1-2 picking them say, they go at this kind of treatment. Hey, una this picker get this kind case so they una help them. Then take them, then go. Then they say, will they tell thank you to the president? Will they tell thank you to this minister? This not the mentality. They really want for let we left na this kind of situation. Let we just start like yes, not for grow. We just stick they one side. Like how that Imam can say, let we just stagnant. This na the problem, the situation every other day. But we hope say one day we people them we get the sense for no say. Then things they have to wait them people are to do for we not to favor. We put 10 day for let them do them. Not to their money na them pocket, na the government money. And now out of your same money back. Now they do. How for on earth I go get me money. Then at the beginning beg you back for do anything I want. But again, then they benefit themselves, then fumble them. Thief we money them, bill us them when they want for bill. We defect for them, cost for them. At the end of the day, now we back real life the day at risk. When then they sit down with their own family them, now they safe heaven. But still, we know they get the sense. Still, we they go the wrong way every other day. Okay, as we don't get this one, I just try for build for you the foundation so we they can go straight and see with all the kind of situation how they face so. Let you see the big one then, how then they lavish with money, thief the money go keep them in the name of medical. We come to that one day, serious one. But first of all, let me can go back and see this thing. Let me go back and see this thing. Where you find out say, the one then says where they work every time, if person want for go and in and out of the country, he get for pay $80. $80. Then say, for corona test and all things. $80 now they pay to the government. But yet still, they want them when they walk in front of this thing. Yeah? Where they are the lab, they are this, then that. They know they pay them the money where they're supposed to pay them. Yeah? So let me just take a look at this one and listen to this one where 98.1 do for we. We'll come back just now.
9 good months this inside January, they know they pay we. We will expect for salary inside a holiday, nothing to nothing.
With the risk we life, we not get we allowance. We want no way forward for we allowance, so we know who side we money they go.
The invoice and the way you just listen to, now some well body work man them, where they work na different COVID-19 treatment center them na free tongue. But they talk about the challenge, what they get for their salary. After with them people here, be do one peaceful protest na Cotton Tree near State House. because then people here say they want to make the president nobody challenge when they get for do the work. But waiting at the challenge, where them everybody work money at the gates.
We don't work since when COVID starts. And we still work and the COVID still rise every day in the country. So if that's right, we never continue for the work no more without salary. The authorities are concerned. They know they talk to us every day. Why should they risk with life? Then they're in the office. Now then they get higher money than we would in the hospital. They risk with life. Day and night today in the red zone they work. They know they pay with. Let them pay with money now that we need. Or else we not go stop the protest or we not go stop the strike. No retreat, no surrender.
How the one they will live. They will get people and they bury. Some people they don't leave their home them because of this sick. Then they get them at the houses them. And some people they take today, then they out of the houses them. How they want they will live. And now we serve Nane could come to the notice of the president. They intervene, then pay money.
We come today because Nakova owe 8 months. Now the 9 months we don't start, so without no risk allowance. Let them pay we. Now that's make we come out today. Now we don't hear say that they pay. That they pay the other one, then they need to pay we. So now I make one also we money they go.
Would they say that they pay and one and they receive salary right now from NACOVAC. Now the big one and they do EOC with the laboratory technician there. But as for with the nurses, hygienists, doctors, we not they get pay and the talk the spread say they don't pay. We will be say we not ever receive salary from when they last pay we April. Now the 9 months so don't enter, then they promise to not they get. Even weeks allowance say them say they give it out per day, we not ever receive her. I let them pay money. If not so that they not they work. Every day the COVID case increase. Up to now, they even promise you inside the same April say some of phone not get pin code and they give it up to now for me they take documents and we not see pin code today, we not see pin code tomorrow. So they are they beg, they let them pay money there.
After them people here, we do this peaceful protest with placard them where they all who say the right say they want in salary payment and other thing them. Some party workman them we later meet with some official them na State House. Who say them we go talk to them. But waiting at the agreement when them people here don't get concerning them payments. Dr. Noah Tucker, now one part the clinical team member na the 34 military hospital, he explained.
So we can at State House, we go directly, we meet with stakeholders, we go to meet with the secretary to the president. So then assure we say then we'll meet with the Ministry of Finance for see how they will address the allowance issue when at the backlog. Starting from there, after the backlog, then this tell them say this is a national fight. Since it's a national fight and a pandemic they all over, we don't decide say we then pay we may just say no more risk allowance for COVID, special COVID workers in a treatment center. May just be like a national fight, like where they fight malaria and free healthcare. So if you they work now 34, you know say now under Ministry of Health they work. Now your salary they get, not a special salary for COVID and also not other salary. So we don't know if this one done, other one get for comeback. So we don't decide say let them pay with the backlog because that one day we actually suffer for and a contract will sign. So we agree so far with them because now then at the head because we not get no power. We just meet them peacefully from our hotel and say we're not happy with the way they treat it.
As the agreements they talk about how they get for pay their workmania, then backlog salary. The workmania, they hope say they will get their salary before January end because then say now inside this January then contracts they done when they get with NACOVAC. For Radio Democracy, Princess Pierce reports.
Well, this is not the first part of now we find out say in as much as where we they talk about this $80 every month, not in 5 hours every month, $80 where you come in, $80 where you go out for every single passenger where they walk through the airport. Still, with frontline workers them, they cry say they not get their salary. In fact, the risk allowance, they not they get them at all. They not get pin code, but every day then they sing Paris national anthem say they don't employ 5,000 workmen them. They don't this all the workmen the way they waiting. They're very satisfied. Then they pay them regularly. All of them But this not to the first thing. Every other day when we come and sit down talk about how them people here not agree for pay. You will get 1 or 2 people where they come tell we say we just not like the government. This not just sabotage. na saboteurs them. Then they come no more from talk the bad things them. The government they pay. This na the only government when not the owe workman them salary. Before they say in 29 of the month, 28, they don't pay them. But every other day, you the yearly workman them. Not to one side, all over the country. The one the way they pan COVID. Then they cry every day. Then get for pay with 6 months. Then get for pay with 8 months. Then get for pay with 9 months. The other time, where they go na how they call them Connaught, even Connaught, the one that way the clean. Strike for 9 months salary. Then turn a one kind way by the people them back. This na the government where we they work with. This na the kind leadership where we they talk about. But when they sit down, they talk to people that we not understand. Then we begin tell them say, now we get the best. In fact, this now one of the best governments. In fact, workman them, health workers them, we value them. We see it go one time outside na the east. They talk about how value the workman them. Then they are the top of the agenda. But right now we see from where this COVID begin, we even from 34, we find out say the workman them. Even side for let them sit down. Where then they don't work na the lab, the technician them. Let them sit down and rest. You know they pass them, they go sweep under mango tick, sit down. And in some cases them, the soldier man and they even driving them they. This na the kind priority when we say when they prioritize the health workman them. Now we system. Look at this other thing. Then now we find out say in this because of them are ordinary frontline workers them where they risk everything for go fight them. Now one for transform the thing say able this na national fight, you know, we for fight like how they fight malaria fight, you know, lay before say the normal salary where you been they get, we not for talk about that one day again because all what you care about a national fight, you no need for get double salary. But guess what? When it comes to the one them where they na NACOVAC, the one them wey sit down and NACOVAC, na different story, my brother and sister them. Some of una been don't actually they get them things they also where we they talk about. Because when you come to NACOVAC, them not to national fight. For them, then they risk everything. So what thing they happen? Then they get double salary. Double salary. Then they pay them. If then a deputy minister or then a minister, then they pay them their salary. And then if them then a NACOVAC a senior somebody back, then they pay them double. So then they get 2 salary. For them, that is cool because then they risk their life. But now the one them waiting in front of the fight, no get anything waiting for benefit. Brother and sister them, nothing say we just want to waste your time. Let me go down back and hear from the horse's mouth. Some of you not don't listen, but in case you just join, we not listen to it. Listen and we come back.
We're not paying people we're inside the same job, like I mean within our finance. The job I did not cover completely different from the job I did in Ministry of Finance. I wear both hats and I still carry on my 2 responsibility. Very, very
But you don't get the double pay.
Yes, they pay me my regular salary as a minister, deputy minister of finance, and I get additional allowances. So risk allowance for my exposure.
So your allowance, for example, you get a NACOVAC, it pass the pay we get as deputy minister and Ministry of Finance.
I go say yes. Yeah, I go
so
say yes. So
what's the risk we involve you work, for example, when an office work for coordinate?
It's not office work.
What's the risk we involve now you work?
It's not only office work. Okay, it's a special dispensation. Where your work is an emergency. Okay, you're working relatively full time without stop.
So what's the risk we involved in that?
It's a risk of loss of life, of contacting COVID, and in the process loss of life.
But not to you to do testing, for example, not to you to go out to the people in a quarantine.
You are everybody working in NACOVAC is directly exposed to the entire risk of COVID-19. Okay, like many other persons actually. So this is deemed a special emergency operation where we don't value people that we sacrifice for they on the front line that way. That's why I can give you more information about this. Government even decide for cover all the 11,000 plus healthcare workers with a health insurance scheme in case in the process of carrying out their work, any of them get affected. All 11, not only the one that were directly involved.
Okay, most of una been don't actually listen this thing, so we just decide for cut the small part. You hear when the health workman them they talk, then say the one them we sit down in office, now them then they give double pay. Then way they risk their life, they know they pay them waiting they're supposed to pay them. Some of you now been the listing, they say, Abona just lie. Now we bring and come back for let you confirm say waiting the health workman and they been the talk. Not to joke, not true. Listen to waiting this man talk again. He say they get a regular salary as deputy minister, then they get a risk allowance. So a risk allowance even pass in your regular salary where they get as deputy minister. A risk allowance where they get for fight the corona, it pass the regular salary where they get. Let's say for example, then they pay them 17 million. Let's say 17 million per month. Then a risk allowance pass in salary. When mean say if they pay 17 million per month as deputy minister, then they pay like 20 million per month as somebody within a NACOVAC. But now look down, look them down, how it filter. They want them when really because what it is say make them they pay them that kind of money they he say then they pay them that money they because na a allowance because because of the kind of risk we involved in the job where they do. Guess the job where they do. And then an office, they sign paper, then buy SUV or Prado Jeep for them, then they waka out with AC. Yeah? Then sit down at the office, call the DHMT, district management team, call provincial management team, and ask them, how na they do down there, how all team, I hope say this day and that, I hope say this day and that. This na the risk of life when they talk about. Then they pay them more than with the salary, when are the regular salary where they get. So, because this na emergency, take note, he say, because this na emergency, so waiting, then therefore give them special treatment. And according to them, they get 11,000 plus health workman that they take care of. And they even don't give the thing called health insurance. My brother and sister them. If are they alive, you not give me thing for it. Now we are die. Now you go give me thing for it. This now big black lie. Whatever happened to them, now just for blow their own. Anything happened to them along the line, now Buffy. Nothing not come up behind that. If you're not able for pay me, waiting due me when you say this na me risk allowance, you're not able for pay me. But you pay the one way sit down at office, then buy for a Jeep SUV. When in fact some of them contact tracer, then this and that when they can get even bike pass when they rob multiple then they go buy them. Now problem. Wait oh, sometimes you didn't miss something out. I want we go step by step. Let we hear it again. Waiting this man they talk. I say they talk and they stop them and analyze for you something.
So we're not pay people we're inside the same job, like I mean within a finance. The job I did in ACOVAC, completely different from the job I did in the Ministry of Finance. I wear both hats and I still carry on my two responsibility.
So, in other words, if you say they're not they pay people them, you know what they try for do so, it be they try for play safe. Because as a government, when you they work inside the government, you're not supposed to get two salary from the same consolidated fund, from the Bank of Salon, from the country in couple. You're not supposed to forget two salary. So if they try for play smart, say they're not they pay them, you know, when they're on the same job, but because the job where they do is different, so now safe play if they try for do. Let me continue.
Very, very.
But you get the double pay.
Yes, they pay me my regular salary as a minister, deputy minister of finance, and I get additional allowances.
So now you see it gets two salary. But in the case of the arrangement, where them people also they get right now, they want the way come on and go protest now cutting tree for sake of the 9 months backlog salary where they don't go inside so now. Then now they tell them say this na national fight. This if we pay una this last one and we not go get for the pay una risk allowance again because we get for take and say this na national fight. So if for be normal like how we the malaria because it don't deal with we then they pay you. So we no need for the pay extra. This na for the ordinary people. You see how always them people are the suffer we. When it come to we. When they risk with life, then at the ground, then say they're not for pay una 2 term. But when it comes to them at the top, then they pay them 2 term. Let me continue.
Allowance for my exposure.
So your allowance, for example, you get a NACOVAC, it pass the pay we they get as deputy minister and Ministry of Finance.
I go say yes.
So in risk allowance, like I don't explain, it pass am. If then they pay 70 million for in regular salary, they pay 20 million for in risk allowance. But that ordinary man for even get in risk allowance, no problem. Why then they get this risk allowance?
Yeah, I go
so
say
what's the risk we involve you work, for example, when an office work for coordinate?
It's not office work.
What's the risk we involve now you work?
It's not only office work. Okay? It's a special dispensation.
So normally, when person they lie, he not ask for no. The tone they change, the way how they present the word, it try for pick am and it afraid. Especially person where he knows say this na lie, they lie. But he not too much there into the game for lie. Not like the Rado Yoki Sierra call them. Yeah, they try for pick in word because now it expose himself when he not even conscious. Now he don't even notice now at the back of his mind say I don't mess up. So waiting I for do, I for try for play safe. Now the risk of life. It in our office so not to eat that there is a health worker with the protest.
Where you're working is an emergency. Okay, you're working relatively full time without stop.
So what's the risk we involved in that?
It's a risk of loss of life.
So for just work full time without stop, now risk of loss of life. Full time. You do work morning. Interestingly, then people are then they go work 9 o'clock, or let us say 8 o'clock, 5 o'clock, then they're off. If they come back for day 5, 6, 7 na overtime, then they pay them that extra overtime day. Then they pay them for that. But the ordinary worker, the ordinary workman pass he go back na treat, begin beg una, they una give we money, yeah we beg una give we don't work 9 months. But these people, very wicked people, very, very wicked, that risk of life they must meet una one day.
Contacting COVID and in the process loss of life.
But not to you to do testing, for example, not to you to go out to the people in a quarantine.
You are directly, everybody working in NACOVAC is directly exposed to the entire risk of COVID-19. Okay.
So if you know they go test, you know they go na quarantine host, you know they go directly communicate with the person where you don't get infected. Who's risk that one day? Naturally, whether you work or you know work or the world right now they say we all they at risk. We all they at risk. So I think say the government for begin the pay we phone because all they at risk. Yeah? Because we say self with the quarter self they get right now at risk. So they need for the pay. Yeah? Look at this team. Full guys them. Full guy them. Thief man them.
Like many other persons, actually. So this is deemed a special emergency operation where we don't value people that we sacrifice for they on the front line that way. That's why I can give you more information about this. Government even decide for cover all the 11,000 plus healthcare workers with a health insurance scheme. In case in the process of carrying out their work, any of them get affected, all 11, not only the one that were directly involved.
So, you don't hear now. This now the way how them people are, they actually misbehave with we. But yet still, you get certain people them where not they see reason for any of them things they are. So, all waiting they care about now for just the vuvuzela for them people here. Every day they Allah for them people here. Not knowing that now we all now we suffer together. But this not the thing where we try for talk. If we not get sense now, we not go ever get sense again. Because every day them people here they strategize for we. Every day then they put things them in place for we. And every day, then they see things them where they go on, where now they no more they want for let we day. They not ever want for let we move, then just want for let we day that one side day, and nothing better no come out of that one day at all. So this now the situation where we face every day, now the crisis this where we face every day from we leaders them. But yet still we get we own people them, we not still get sense. If you see them just know them people are come on a street just now. Now then they come back and begin Allah. Begin sing. If just now this government say, I don't make this hospital, I don't make this, they not even know. Waiting at the criteria, waiting at the condition behind that hospital the way they don't make. All waiting they care about. The government say they don't do this. Then waiting they happen next. Then begin sing, begin dance, then they go lunch. Then sing, the dance. You know waiting, when they go commission. Every day we get different things them. I just hope I just hope one day we people them go see reason and no say then things they are waiting people here they do. Not to favor than they do for we. Rather, na thing when they use self responsibility na then they do. Until we reach na that point, we say we dey realize say then people are not they do we favor, we no go ever develop. The country no go ever, the country no go ever develop because every day we always dey feel say then they do favor for we. And as long as that they be, we dey give them scope for let them continue for do all waiting they use for do. These na things that we need for comot from. Now, I don't try for build this foundation for you. Let you see how them people here, even inside the country, how then they misuse the couple. Where we dey say, na in our own couple, they need for improve the health situation of our country. But yet still, they get different way how then they look at them things there. So, we dey continue for make you understand say, them people here, they really not good for we country. Them people here every day they get different strategy when they use for make sure say they make you see them like them na the godfather. They make you see them like for say na them unique like without them we not go able for live, which of course not also it be. Now if we don't hear read this, let you see how with it like for the people them how they really they suffer. The next thing where we basically they can look into now for let you see now how the money they go now fitty fatter inside the audit report where we they talk about. Inside this audit report, we money they go like nobody business. Like nobody business. It just they go. It just they go. Until we see them thing they are. Brother and sister them, it's not easy for we. It really not easy for we. We get for get sense. We get for know what we they do. Then we go able for see. When they say you get for know you left from your right. Now in at them particular point here. And they can go inside the audit report. Let you see something briefly as we they go inside the audit report. Let you see waiting at the things them where them people here they do behind we back. But before we then they make like for say then a saint. We are about not a saint, na scent, then the smell. Not a saint at all, na just scent with the smell pan people them. But when we don't know, we feel say then a saint. We begin the dance and feel say then are the most holy parts what they ever talk about. Let's see this thing now. Maybe I just go into the audit report. Are they both go inside the audit report of 2019 and the one again for 2020? Let you see something quick here. 2019 and 2020 audit report. This first one waiting at the screen so now 2020 the recent one we don't come out. Let me go first background. Let me see who side we come out from 2020. Yes, the 2019 audit report. Look at this thing. You see, expenditure management and control. This now basically inside the health Ministry of Health. Now there we do so. Expenditure on oversea medical support. One thing before I go into this, you see say we dey cry for help. We dey cry say we not get things them for make lay we life go before. We dey say every day the hospital them medicine all day. We dey cry every day say we picking them they go na hospital nothing all day for lay them able for survive. We woman them they go na hospital for go born but at the end of the day pass you thought you water you care and go na cottage pass you care go soap pass you care go even decide outside the woman they go sit down or lay down for born. You if he matter of force you go to them. No structure, no day. Nothing absolutely. This man come and tell we say waiting. He want for see say things them be better. So before I go into this thing proper one thing we I want for let me look inside. Let me go back. Let's just try for let me hand on this thing. Let me go back quick one. Inside the time where this man come. Where he come, waiting he tell we about cottage hospital. Waiting he tell we about cottage and how he want for make sure say things them be okay past how it is so right now. Let's see if we can able see a quick one, yeah. Let's just find them for now. Let me see the things them where he been begin for talk. The time where he come, he say he want for make things better. And now where he don't dey inside the waiting don't happen if he actually don't able for develop anything out of the things them where he been they say. Please just like get a few time la just phenom and not be based on the discussion I make I want for count let you see exactly what's in the happen because we not be done very well. We not be done put them na the agenda for today. But because of the discussion, let me go back and watch the time where it just come. Waiting it talk about the cottage hospital as it go work at it.
I'm not pleased with what I say in terms of the condition of the hospital. I think we can do better. There's congestion, the hygiene situation is nothing to write home about. But in terms of the turnout of the personnel, I meet the doctor Naya, Bidonde Naya, well before time, and most of the other senior staff, Bidonde, which you are not happy about. Now, this place is where they give birth to children and take care of women. Definitely not in good condition and not enough for the woman there.
This is the presidential program for say everybody hands on deck for make sure we take this country forward. They want to demonstrate for find out exactly whether the people are punctual, and if you're punctual, that means they come on time, and if you come on time, you're more productive in this country, and if you're more productive, the country will go forward.
When can in time on an announce, okay, in mid system they because make and see what they happen. So they're going to make all challenges them, they will make for help. They go to place no spacious, so you said wait up. We need for me to get another country because too spacious and people are coming. So I feel happy where you come.
The health sector very critical for this country because we feel say we get healthy nation, you get a wealthy nation. But also importantly, the fact there are two things. One, for me, we can check the facilities them, we get a PCMH and see how we improve on them. But also more importantly, for me to check the people that go according to what in question we don't say for let people that come 8:30 in the morning.
Fine, now sorry for me. Discipline for them in the country. And President Biokam, he said he come with discipline. And that discipline, they need to work with so. And not supposed to notice nobody.
That's a very good impression for Chelsea say. He concern, he care about him. Yeah. Say to the next person, can you imagine, yeah? You say if it's about here that they sweat. So not to place this way, everybody can just pop in, then he can't visit with. But when you see, he can't visit with, in the sweat so. I know that somebody will get concerned.
Well, a lot of people will say Saloma not the change. But what me see, when they see positive change, then they join. And what me don't see, a lot of people don't join. They invite all the one that will not join it, for me to join with, for me to change Salon. Now the only way that, we man not get for can change them, now we get for change them.
Unfortunate. Really unfortunate. This man know how for talk, for lie to people them. But they don't know how for maintain them things then they. This now when they just take over office, then tell them where they go all around, they do it in. They do it in and call monitoring. Where he say they go and check almost o'clock, people them they go now then different place them for go work. Now they tell them this way he actually go in a cottage for see waiting they happen there. And when he go in a cottage, he actually tell them say he not glady with waiting he see. Remember this he been just scam, new spirits na graveyard. He say he not glady with waiting he see they go on a cottage. So waiting he do. He say first of all he want for change the system. Because he not glady with outside and the bond. What outside and the bond water been the warm day. And then day you get bed where they outside the woman the bond. But as we talk so right now, please go on Twitter and follow come on, I don't forget this doctor in name. Sorry about that. Where every day they tell we about the different things that we're missing at the cottage hospital. Even cannula, injection, needle. They're all the things and this way missing at the hospital. Even water for one's hand when you don't attend to Kumbra or to Bele Woman. In all day, pass the family members them, touch the water in a bucket or plastic water, come with them before they're able for use them. This now waiting they happen now. So now I feel disappointed. Because he pretend as if he know the situation, he feel for the woman them, not knowing that he just go tell una say, until now they say the thing not better, the one una go see it go worst. That cottage, that woman they be the talk say, until now they see, instead of the sweat, the place hot, this and that. In other words, AC not in the place. As we go inside the right, inside the labor room, all the other side them, the AC they all the rotting down for them from the time where it come. Nothing not they go on at the cottage hospital. Nothing. Every day problem. Every day problem at the hospital. Pass this BNTM, one organization now they try for work with the Macaulay Street Hospital with cottage for make sure say they able for get connection for water. Even that they say no be real life in it. But this now the man will tell you say he value. He tell you say the health sector very critical. He want for develop them 4 years down the line. He been tell we say 1, 2 every year they go 1 year not do. You need for give me more time. We don't go 2 years. 2 years not do. You not gonna expect me for change this kind of way in 2 years. 3 years. 3 years. You don't expect say waiting don't happen all in the last 11 years. Me go able for can do in 3 years. 4 years. Can watch the say back ba. The 5 years not even do. The way how APC don't damage this country here, una need for give me more time. So if una vote for me back, I will able for improve all of them things also. But this now waiting he talk when he just come na office as the caretaker of Riyadh. He get the zeal. He get the miri inside him. He say the waka. Now all of them thing they na oyeng. Nothing not dey happen again. All don't go dormant. All don't go down. Now, you don't see waiting at the try for do. I just basically the try for see waiting they happen. For let you see say the system really the worst every day. Then SSF not get mind. They not get mind. Let any one of the doctor or nurses them touch them or them picking them inside the country. None. Let's go back into this. Let's go into the audit report. I think now that will be the focus for today's program. For let me go inside the audit report and see something. This now the audit report for 2019. Let me see what in this audit report of 2019 say. Under expenditure management and control. Basically, this man has way been come. He as well they grumble about waiting. He grumble about the I call this thing. The oversea travel, the way how the last government be the travel. But interestingly, this man where he don't come so now times he don't times the way how when you put the way how the government been travel the last time, you the times them by 5 to how he alone don't travel in just approximately 4 years. Let me see something. Waiting the audit report of 2019 say. When I didn't begin get problem with Lara, let me go straight. It says expenditure on overseas medical support and fuel. It says section 13(1) of the Public Financial Management Act of 2018 stipulates that the vote controller of a budgetary agency shall be responsible for prudent, effective, efficient, and transparent use of the resources of the budgetary agency. Contrary to this provision, we noted the following. So, in as much as then they say the one where the vote controller, basically sometimes the vote controller can get for be like the permanent secretary or the head of the manager of that particular project or so. But for the ministry, most times the vote controller can get for be the permanent secretary. Let me go. Then say they notice this for overseas treatment. Now you can begin see when they just come in 2019. Yeah, waiting the report say about almost then spend per overseas treatment for the young family. Let we go. They say in spite of several requests, the ministry failed to submit policy or guidelines that govern overseas medical support. But before ever I go into this deep one, something that we have one for we watch because this is a violation of waiting happen inside the 2020 report in SSF. Waiting happen there we make something they really go wrong now where we not able for control. It basically get for do at how they manage the medical things them inside the country. Okay, I think I don't miss that side there. So if that be the case, let's continue with Usai Abinejis now. Let you see how then they spend money per overseas travel. Yeah, that's what they say. In spite of the several requests of the ministry failed to submit policy. So in other words, the audit service say they need for put a policy of how them for they go about overseas treatment. oversee medical treatment, but because they no say something they inside that oversee treatment they fail for put together the policy. Okay, then say discussions with key personnel reveal that there was no policy or guidelines that guide the management of oversee medical bills, for which government spent a total of 17,531,448,562 leons. So let me see something here. Then say 13,622,912,402 leons plus 3,811,528,600 and waiting 660. All right. So this not the money actually where then say they go into. Now this money then spend. Let me look how it's like. This now inside 2018 where they come and 2019, and all of this money get for go with them, some of them, and then people where then they give medical scholarship under the government in budget. Let's go to something. Then say the accountant general checklist instructed that payment of overseas medical bills must be made directly into the account of either the hospital or the Sierra Leone embassy or High Commission in the country which the patient is to receive treatment. So basically, I think this I want to look for. This one now, where they recommend, when even the accountant general talk about, for make a checklist, you find out, say, this particular one, this is a 2019 report. Now, this particular thing, the president himself, the caretaker, violate inside this 2020 report. How we do that day, we come to that one day, GG Snow. So you see, so if you want to go do overseas treatment, they're not for give you the money that you earn. They're not for pay on your personal bank account. What they for do? Then for pay them through the embassy. Now we embassy. Now the country you say they go take the treatment. If it missing, then what they do? Then for pay directly inside the hospital or the medical agency in account, but not to inside your own personal account. But let me watch the reggae. What happened? They say this was not the case. Payment for overseas medical bills for a sample 79 patients. 20 in 2019 and 59 patients in 2019, which totaled 1,930,249,260 in 2018 and 6,403,759,160 in 2019 were directly paid into the personal bank account of the patient. Did you understand? Even when they recommend, say, they're not for pay them inside their own personal account. But we know they get with the inside and then bypass all of that and then pay them directly inside their personal account. This is not the amount we didn't talk about 7 billion where they pay into the personal account of people then. Now, only 15 of the 79 patients submitted hospital treatment reports to the ministry. The cost, excluding air ticket and DSA, for the patient and his or accompanying relative. You get the joke, eh? Then say of medical bills accorded to the remaining 69 patients was 6,505,909,280. We could therefore not ascertain whether or not the 64 patients in question went for medical treatment overseas. So you see, all of these 64 patients where they say go for medical bill. This is not 2019 that they talk about. Let you see the systemic problem with the inside. 2019, 64 patients where they say they give money were amounting to over 6.5 billion. they're not even sure if them people they have to actually go take treatment now overseas or if they be sick at all. So now we gotta get work in play. Let's look at the record. Okay, this now the thing will happen. Yeah, let's not go to field. We not go to field. So what we go do now? Let me go now into the audit report of 2020. You don't take note, you take note of several things where then talk inside this report. Let me go now into the report of 2020. The audit report of 2020. Oversea medical bills. You see, oversea medical bills. Don't see them? I like this part no more because other things then they up. Let you see them. Then say on retired payment of oversea medical bills. In other words, they don't give una the couple, but una not come back and can show we say now this way una spend una not show we for say una spend them at all. Una not show we that one day. So if this starts so it means say they as well give personal, then pay the money into personal account. When the audit report of 2019 we don't talk about that one day. But 2020 again, we can't in a farm and they do the same. Let me continue. Now you waiting and saying. Then say a review of payment voucher. So basically, what we try for see in 2018 and 19, we spent over 17 billion. 17 more billion for overseas travel for the young family members them. Then we young poor people them. They suffer. They and they broke. Then the forona man go thick and swell. They not get the basic medical, thing for make them able to get the hand back to normal. You see that Pekin, it just swell, it's strong param. For let it get money, for let it go do medical checkup, and mama not able to afford them at all. But yet still, we get the government, whether and then people them no more. And interestingly, them people them picky where they suffer so. Them mama and papa there, now the number one people them, where the knack chest, where Ashobi, where Polo, dance na street for them politicians there. But when it comes to good medical treatment, the government and fumble them, they take from we money, give them fumble them, go with them. Some of them, even the report the talk say, we're not even sure if they go with them. Then just put somebody in him, say he go they take treatment, they eat the money, whilst we, the people them, they cry, they die for basic medical attention. We not get them. Basic medical, treatment. We not able to get access to them. But we dance every day for them. Politicians they are, but we not go get sense. We not get sense at all. Let's continue for tell you about medical overseas. How we health system the struggle na the country na so we caretaker the government in cabinet but say born me and by you if the papa don't bend all man they bend the caretaker in cabinet they all they take we couple na we country then go sponsor other people the hospital them na then country for say okay we get 17 billion we the go now follow na better in our hospital then we own hospital sometimes they forget water. Forget cannula, where can cost 3,000 leons, 2,000 leons, 5,000 leons. We hospital and not get them. But then get a bold mind, pull 17 billion, give them people and say, when I go, give them hospital and they oversee. Let them enjoy. Who get swear. Then they get blessing, then get structure, then get all thing. This is not the system where we go through. Let me continue and see exactly what in this audit report of 2020 say about overseas again. This is not just a small part of the tool. Now, logo. Then say a review of payment voucher revealed that 6 billion and 59 million 500,000 355 leons. Now money where them pay by the Ministry of Health. Imagine this money what I tell you about soon. This 6 billion over 6 billion. Yeah? Sorry, over 6 billion. Now money this where them pay. Where the Ministry of Health pay. I insist or stress the Ministry of Health pay 6 billion and 59 million 500 and 500,355. This money look the way to me. But basically now over 6 billion, yeah, where they actually use, the Ministry of Health use for oversee medical bills for 35 patients them. So you begin to ask question now, almost them, this government don't take people them where they sick, when are from the public, then say let them go take treatment. We see every day pick people in the camera social media, they cry, hey, I get liver problem, I get heart the enlarge, me this, the that, me kidney, me this, me head the swell, it the big, no more it the big. We see one picking, it just the big. We see one other one, even outside it pass in excretion, outside the poo-poo, it block. We see all of them situation a day. At the end of the day, then they end up for lost their life. But we government, they use over 6 billion. This is not 2020 report. 6 billion spent on for 35 people. Where it be for say, if they take that money, they put some, then they able for put better thing now, cottage, cannot. Let's say for example, when are the two main referral hospital them, then they do better thing they. 6 billion. Then they able for do better thing they. Then the other money where we don't talk about 17 billion. You go to, let's say, Bo Kenima, the headquarters town there, Bo Kenima. You get the waiting, Bombard and McKinney other side. Then they able for do serious things, but then decide say no. Why we for develop your own business? Let us take this money and go give other people them where they already get a structure. Let we just help them. Let them go before. Let them just be go. Then we young people let we put a reverse gear. Let just be go be no more. You get the joke? So now what thing happen? For just 35 people, they spend over 6 billion. Then let me look what thing they saying. They say with exception of ticket. The ticket no mix there. It no mix there at all. The ticket no mix there. Yeah? Excuse me, huh? The ticket no mix there at all. They say with exception of air tickets, yeah, and they say that money where they give themselves say this is pocket money for let you go get accommodation, go able for get it. You know mix there. This not just the medical fee. Medical fee from consultation, the treatment now all medical fee for go say una go take treatment overseas. Una go but una no get swear. Yeah, una enjoy. The one where they can dance. Una come no una done. And una no well una sit down there for sale. Yeah, where election time come. Let the one where get swear. Let they can dance. You understand Then they can dance for we, vote for we, fight for we. Una sit down there. Una no there big lady no ka una na me gentry for tomorrow bambay. Let's continue for say. Then say for which retirement details such as hospital receipt and discharge card were not submitted for the audit inspection. So you see the deal back in 2020. 2019 you don't pass. This is 2020. Even when they don't give them over 6 billion for 35 people for go take treatment. What happen? They knock out with receipt. Or for sure say, I be admitted at this hospital. Now the discharge card this. Who's oversee hospital day? When you go take treatment, they don't give receipt. They don't give discharge card. Who's one? Lebanon, then they give. India, then they give. Because I decided anyway we are yesterday they go now. India, then they give. USA, then they give. Every side, then they give. In fact, them people they know they joke with the receipt. Because they want when they can audit them, then for able for show who that pass through their hand. So for this case, they're not even for able for give this 6 billion what they talk about. They're not even able for give receipts or for sure say we admit at this hospital now the admission card this or now the discharge card this where they give it. They're not able for provide that one day for make the audit service we're able for inspect that one day at all. Sorry, the things escape. Yes, they're not able for provider they for let inspect them at all. And what thing they do? Audit service say? Audit service say they recommend that the retirement as identified be made available for the audit inspection. Let's see what thing they say. Now the official response from the permanent secretary, he say all the patients them where they give all the patients, let's read that first. All patients who have not submitted their retirement have been contacted. So if they not ask una not care about them, Salomon in a free bottle, just spend. Then say they don't contact them for make them go come back and give the retirement, for let them come and give the receipt and the following documents the way they ask for. Yeah. So for those, then say then go submit the copy and however available for audit verification. So then say then they contact them and then go give them make it available for audit for let them watch them things and they. So now we see what in audit say after they don't come back for the second time. Yeah, they say the auditor in comment he say during the time when we can watch back then thing they wanna call we for car watch. Then say copies of retirement documents for a total amount of 808,271,980 leons in respect of 7 of 35 beneficiaries were submitted. So even when they come back after the time when the auditor come, it not been there. After they don't they're able for come say okay, out of the 35 we don't contact, and at the 7 this way they can give. So out of the how many billion? Now just 808 million. Now they able for account for. Now they submit and they verify. Yeah, women say they left a balance of 228,375 where they not give any necessary retirement details, where they're not able for explain how they use that money at all. And this issue partly unresolved. Or partly resolved. Let me say, we not settle and fine. You count half, you left the balance. Where the balance? You don't count them. So, they not only send them people them overseas. In some cases then they even send ghost them overseas for go take treatment. Then they pay for ghost, for go spend, for go take treatment. So, in this case, the government of we country, under caretaker bill, spend over 5,251,228,375 loans per ghost. People that way know they exist. Now he spend them pan. He say even the ghost themselves, them better let them go overseas and go take treatment. When I eat them, when I enjoy. This not just caretaker bill invoice them, not only caretaker bill instead for they talk about. Now just invoice them. Waiting them capable of doing from the Ministry of Health. Let me go something quicker. Let me drop down small bit and say expenditure on tickets, air tickets, not adequately supported. So now, until we don't talk about the medical, let me talk about the ticket money. Let me talk about the ticket money. I wonder waiting they happen. I see cost and the car inside. I don't know really waiting they happen. I see cost and the car inside. I hope nothing no wrong. I just hope nothing no wrong. Okay, so I move. Let me go now to tickets. Then say a total amounting to 1,284,003,000 was spent to purchase air tickets for patients and accompanying relatives to travel for overseas medical treatment. So after when they don't give them that money, the ghost, they don't give them 5 billion for go, then buy tickets for the ghost them and then family them back. Then buy tickets for them, for let them go. Yeah? Say you now go enjoy your ghost. Yeah? So what thing happen? Yeah, for the overseas treatment. Then say there was no adequate supporting documents such as invoice, itinerary, or of patients and relatives, photocopied passport, etc. attached to payment voucher. So in other words, before ever, then they approve the money for you. If you come with all of them things then they, yeah. I can remember one year been there where I be one for travel for go US. Yeah. So I not been getting the option, but new those years long years ago, Yeah, because I mean, actually, when you work with IRN and all that in them, you know, independent radio network, you the partner. So I've been approached, knew them being get for fill me how do you call them, a visa application, all of them things. So you get for providing things and they for them for let them see say yes, now genuine something before ever they give the money. So what thing happen in this case? The how do you call them? The invoice. That thing where you go say, I want this ticket to almost the ticket and say na so okay, give me invoice. Then make this thing as something like receipt, but this now one way you know pay it now in advance, receipt in advance. You give then in the counter now you say okay yes now the ticket amount this before they give the money you go pay then you count the receipt back. So then make sure say the ticket they not get any supporting document, they not get that invoice, they not get itinerary. When you say itinerary of the patient, basically now how the patient get for waka. Who stay in the left na the country. Usai the drop, usai, how much just they take in that, how much just take a return back. That itinerary, that way, that planning. How we get for move. Nothing like that, they know they. Not even the patient in your relative them. Not even photocopy of them passports. Yeah? Not they. Now the payment voucher. I tell you say now ghost there and ghost not get passport. It can just go. So all of that and they missing, then just take how many billion? 1,228,000,000 and more. Give them. Say them buy tickets for go overseas for go take treatment. Nothing exactly, etc. Nothing no happen. Nothing no go on again after that one day. Then say there was no adequate supporting documents. Okay, I don't get this one. So nothing like that one day no ever exist. So now you waiting the Sakibokia thing, then self reply. Waiting and say. Then come then give official response. The official response now from the permanent secretary. Yeah, now you see low list what you say. This now the Ministry of Health no matter. I now go to the big Anyampi too. That Anyampi where they call in company Anyampi. I now go to right too. That Anyampi where senior so much that it thief people a receipt. It can make a other way. I now go to right too. I don't know if something really wrong. Sorry about that. Hello? Okay, are they on the live program right now? Okay, sorry about that. I feel say something wrong with somebody they call continuously. All right. So we go now and see what thing they happen. Now, when they don't get all of this, what thing they say? The PS come and say all the patients them who have not submitted their retirement have been now the same thing, no the same old story. This now one great word no more nice sabi. One great word nice sabi. One great word. So wetin happen? The relevant source documents of look watch wetin happen. After we can the audit and they come back and can verify. They say relevant supporting documents of 220,494,000 leons we are submitted and verified. We mean say the little cow dandy out of the almost and dandy didn't cow it. So wetin happen? From a total payment of 1,284,000,000. So the 1 billion was the way they say it dance limbo dance. It then on your own level. It on limbo. It just the dance for himself. Nobody knows side day. Yeah, say for cost of air tickets, the balance, yeah, now 1,063,509,000. It just the float. Nobody no able get aid or tail for them. It just the float. No documents, no they really able for provide for that day. So this now the things them where they happen with regards this particular audit. Yeah. So wetin happen? We been just say let me take this basic thing and say we can't follow we touch small bits. So now we don't touch on Ministry of Health. So for let you know say this not a Ministry of Health business no more. Not a Ministry of Health business. You get other things them where they happen. Let me go something here. This same corona where we dey talk about where the workman and they cry every day. Let we see wetin dem do with regards this and how dem say dem spend. I tell you say. This government, the benefit, they spend, they pay attention for spend per other people in country. their own health system, and then waiting they happen, then they abandon we own system. Let's see something. They say management of funds for cooperation agreement programs. That is the COVID, for example. They get Cuban doctors and other one there. Let's see what they say. Then say contrary to section 13(1) and 31 of the Public Financial Management Regulations of 2018, there was inadequate control over management of funds for cooperation agreement programs in respect of the Cuban and Nigerian health personnel during the fight against the COVID-19 pandemic. We observed the following. Let's see here. Can't see money. About way money, spend money. Then get one song like you say, na your papa money. This then they ask, na your papa money. Then this so, enjoy the spend. What will get them? So now let's see what they say. They say a total amount of 257,586,000 was overspent on goods and services procured without authority. From the sum of 6,490,000,000 remitted to the ministry and 5,434,000,000 and 16,178 was retired, leaving a balance of 1,055,983,822 not retired or paid back into the consolidated fund. So you see, so you get here now, you get 1 billion, 1.5. What did I say? 1,055,000,000. Yes, approximately 1.5 billion. We then say, okay, until don't pay down, they no put this in our pocket. Remember what that chief minister say? Oh, you know, use now put 1% now in our pocket. So then they listing exactly what in the going. Let's go back and see what in the happen. Then say payment records also showed a loan of almost 130 million for the clearing of a 40-feet shipping container without the required authority, and there was no evidence of repayment of this loan. Additionally, from the funds for the technical aid corps when attacked, we verified repayment of loan of 600 million without authorization and evidence of the initial loan and how the amount was spent. So look at this. This one very interesting. Now, in this one, under waiting and called technical aid corp, then say then pay loan of 600 million loans, 600 million loans, but they not ever show who side then get the loan agreement. They not ever show the initial loan where they give them, how they pass with them, but then say waiting, then pay loan of 600 million loans. You see? We can't read. It's sweet, oh. It's sweet. It's really, really sweet. Then just the give it zigizo. Anybody we can they give it bonfun. That's what I can say. That ball will be the play small. You know the team up so that the one man they middle. We are the people then. Now we team up middle. Then are the players them. So when we one go under them bang we go so. We go under them bang we go to. We go under them bang we so. Then say we na Christmas them we not get sense. Because na Christmas no more you do so. How you go pay loan? You pay loan, but you not take loan. So that you pay too. We can understand it. You know, they get it. Me uncle and me auntie, they wham, they sass. Then they pay loan. Anyway, so let we continue and see something. Waiting and say, because there are any day they get explanation. No, now you waiting they explain say. Then say the PS, he come and say, on the issue of the overspent 257 million and more. Then say you see attached copy. Okay. This unlock not into important. Now you're waiting the auditor saying. It said despite the responses received from management, no evidence was submitted for audit inspection. Therefore, the issue. So all the explanation, then just they explain. The 600 million loan or the quote and this and that. So always they say they carry it. You see, 600 million quoted by the auditor is not a loan, but a transaction error which was reversed immediately. See. So now you see the thing, They say the 600 million where them be don't write. Then take them, they write and they say loan. Then take them, they write and say we pay loan. Now they say no, na mistake we make, not a loan, na error, transaction error. 600 million transaction. Hey, we country is sweet. It's sweet, but you're not going to pass the thief. Sit down and you eat. That you don't say the sweet is sweet. Can you imagine? Now, let me go sometime. Let me see. Payment without supporting document. So daba daba na inside this thing. So daba daba. So daba daba. Let's see what they say again. They say payment without supporting the document. In other words, now like I say I buy this phone, I pay for them, but no supporting document no dey. You number one, not show me say this na invoice. Number one, you not tell me say this na receipt. I just pay no more. Like for say I go na PZ now I go pay, or I go na Swazi. I say bro, I want phone no. Just give me no more. No, you boy receipts no more, but let me get am. Let me say get am. Nobody no get for ask me. So the government they pay now. Then they pay like any Swazi businessman right now. Let we go. Then say withdrawal of 3 million. Withdrawal of 3 billion. Listen, oh, the money then can make me the art. 3 billion 870 million 760,085 leons. I hope I get them. From the ministry Impress bank accounts. Now then take. When they say Impress, so basically Impress now the money we use for do small things. Then, for example, if stationery you know they we buy stationery, fuel, other small things. Then where they say Impress, yeah. Now then we the transport, you know, other things. Then now that kind of money they, yeah, we use as Impress, yeah. So let we go. We say. Then we draw this particular money from account number 0112008316 held as the Bank of Sierra Leone where without payment voucher. So then take the money, but they not put payment voucher for sure say we actually don't take it. So waiting at the thing, then they come back, then take the money, then send paper and we eye. Follow you no understand self. How we go then turn fufu weed. You know say when you don't turn, you the check, you begin go so no money. So then they do it. Because how you go take money, you no get payment voucher. Now so they can do. Then just the take. Now that make that big man, where that other white here Arata, he can't tell we say them bribe $63 million. Now so they do. Then take then because they want for cover up now. So now make can say $63 million. Waiting men can fella do for bribery. Yeng nothing happen because them bribe for sake me uncle when I own self uncle. We'll go move. Then take this money. Then say therefore recommend that the payment record of as identified be made available for audit. So basically, then they ask. Then let them come back and explain how they use that kind of money. There, yeah. So then come and make a response and say the relevant supporting documents are available for verification. They make big man. Lawyer waiting the audit report say, yeah. This is a 2020 report video because we want lay una the understand waiting they happen. Lay we no mistake. We not forget the thief where they don't thief where they go. Because this not the words the way the caretaker be use. Then thief. You know the same right now they get all kind terminology. Now this then call her mere auditor opinion. Then call her again mismanagement and other things there. But in the previous time, then we call them thief. The government then thief, corruption. But now not just mere opinions from the Auditor General. You know, we did defend the defenseless. You understand what I mean? So let me move. What in the Auditor General he said from the total expenditure of 3 billion, yeah, 870 million 760,085 leons payment voucher and the relevant supporting documents to the tune of 3 billion 732 million 227,585 we are submitted, leaving a balance of 138 million. Is it? No? Yes, 138. Not a million. This one. Yes, 138 million 532,500. I get them. 138,532,500 leons without. So when they don't go knock the head. And bra, I'll tell you something. When you use something, you don't need for go begin count this surplus. Now only who don't understand and you waiting. For example, me not a phone mechanic, I can't open this phone. You find out say all the screws them equally, but when I open this phone, by the time they lock them back, when they get surplus screw, where they be where me the reserve now because the man we make an all left am. Now like this. Then say they use this money. Then pull the bulk money, they say they use them. But by the time they go and subtract, because not to the work, they not use them for the right purpose. By the time they come, you see say remainder this to left. Because if me, at the end of the day, I buy book 500, I buy this 500, I get the receipt and they give me. But as you come, oh, I'm not been there then 10, but look the receipt, so una watch channel, 9 or not to in, I go me go so. Remainder minus plus more for the day. Now exact. But in this case, what written and say over this day without supporting documents. Additionally, of the 3,732,227,585 submitted for verification, payment for the tune of 23,635,000 were not adequately supported with the required documents. This issue is partly resolved. So you see the program inside the program. You see the program. So sometimes let we can keep comping. One time at least let we just see what in the audit report say. And I bet you most of you are not get interest in the audit report right now. This na the basic thing of we begin something. We start out with noise. Hey, they don't thief. It's even by September in. By the time make, hey, they don't thief. We see the cow up now and it's quiet. We just the watch no more now. So most of we not get interest again on the audit report. I bet you. Right, I watch almost people and don't like the program 82. If you get interest and if you say useful, hit the like button for we. Give me 150 likes and share this program. Thank you. Alright, so we move. Look the other part. Even by recruitment all, then they make criminal. Then say irregularities in the recruitment of junior medical. But before we go into that one day, let us go into this same medical, yeah? Let we know low waiting. We don't touch on the how they call them caretaker in. Yeah, we don't see one time almost money how criminal we caretaker be all we don't bring and come up. Not only say audit reports now say even when they finger the audit report. Let's watch this one when they recruit. Then say we noted irregularities in the recruitment of junior medical personnel during 2020. The required quota agreement by district was not complied with in most instances. You know, so now this area, anytime we see they say, now we area this with the recruit. Watch inside the normal. Right as and they say free education. With the pay. Watch the minus plus where they now zigiza. Okay, now move. Right, Sam? And interestingly, for let you know, say thief they inside this audit report. Plenty sensitive things that they were missing. Notice say the free education, better thing no they. Almost speaking and pay for waiting missing you know they I think then a perfection Mr. and Mrs. Perfection all thing correct all waiting until we then go na for the career outside and go monitor ask. Let's look the timber for example. Nothing no the inside for say they not do timber login this one all 2020 or 2021 nothing no they but timber but good things then they were missing but then they all it is surface one by one. I no doubt Africanist. Then the counter one by one. So let's tell you something. Most of the time, you know, this audit report we not in too much get interest and too na the two parts and especially when it comes to this read. But let's continue. Let's just get the spirit and go on. Yeah. I specifically come because I promise you now. Let's go something. Yeah. Then say. The junior staff they make sure say then go above waiting they say instance upon reviewing the sample request from the district and the comprehensive list prepared by the Ministry Human Resource Directorate, we discovered that all the names are not incorporated into the comprehensive list. So you see, then they come with names, they don't even put find one inside the list. Then say the basic use to select the names to be included in the comprehensive list sent to the HRMO, the Human Resource Management waiting, was not submitted for audit inspection. So they no go submit to mama and papa. How you expect for them give something where they just take like, you know, some of them not even get appointment letter, just take them family, they can catch and they full up then at the payments voucher. That is why we have bloated payment voucher right now. Wage bill. The wage bill just they go up. Then just take the own as to concern and fix and they. So no way they go allow you for the audit. The HRMO, Human Resource Management Office, the list where they're not going to do that there. They're not going to do that there at all. So listen waiting and say. Then say HRMO was not submitted for waiting audit inspection, which may suggest that the recruitment and selection process was not fair and based on merit, contrary to the Rule 22.4 of the Civil Service Code, Regulation and Rules of 2011. So you see what I just been the try for talk. So then just take not to based on merit, then give some of them position in there. So no way not the way they go allow una for let una look into the recruitment list. Then just take them family. Hey, this night be fit for you. This he puts 2 people in down for the party. Then gam. Hey, this he don't say they mother bio. Then gam. Hey, this Prince Adi. This a bon tit and tongue. Then gam. This this elected party in mama and papa and this and that. He been there with we. Then gam. So, watch I'm not to me say, in fact, me not like tribalism. I hate the word tribalism. But watch waiting and say, inside the audit reports, just listen waiting and say. This not exactly waiting then say. You understand it? Now exactly waiting and say. Now, let me continue. Then say the director of human resource should submit evidence of the basis to prepare the comprehensive list. Let me see if it do am or it not do am at all. Sorry. Okay, so upon when they don't tell them, now we are waiting the Auditor General say again. He say, despite the recommendation, a written explanation or additional document we are not submitted. I've been telling you now, say yeah. All man get in your ginger beer where they do. Where me on farm will come where I dance. Madabio. Because I don't sing too much and they give me. Period. So not so because of I made I deserve forget them, but because I sing Madabio. Then they give me. So watch what he say. He say upon when we don't recommend them for give the additional document for make we check. Say all of them things that then comply with the Civil Service Code, Regulation of Rules of 2011. The recruitment of medical personnel, especially nurses, they're not able for do them at all. But guess what? You know, say this government here, every day they say they don't take, remember that man just know, 11,000 workers. They don't recruit 5,000 today. They don't recruit 10,000 today. They don't recruit 11,000 today. But at the same time, you find out say wetin dey happen. They know they go according to the right things them. I want you understand as we dey inside the program, so let you see exactly wetin dey go on. They know they do am at all. They know they follow the right procedure. So they know go know not the way they go able for give you the comprehensive list for let you see whether this day in accordance with this or not. They no good ever do am. They no go ever do am. Now how we dey where we hear Prince Adi in the talk say, them man there where they give their work, who said them for work, they pay them 600,000 any work. But because they do with you to give them 1 million, who said they pull them money then they all? Please hit for the like button if you feel say the information really useful and you want for let we do more. We get about one. You see, the truth that people they know, most people not get interest, so they don't go. So no problem. We go still continue because we want to make sure say we do justice to this one. Let's watch one thing here. Then say staff on payroll and not in the nominal role. So this now another way. Because they want for letting they get paid, then they take them and put them at payroll. But they not go through the other regular process then for let them be full staff or for let they really know say they want there, then go through the right channel. Let's see something waiting they say. They said during our review of payroll and the nominal role submitted for 2020, we observed that the names of 201 staff on the payroll were who received a total salary of 2,394,009,890 during 2020 were not included in the nominal role. We therefore recommend that the Human Resource Director update the nominal role with immediate effect. So basically, what thing they happen? Then take all them, then put them quick one, 201, then put them, pack them at the payroll. Say, when I go take salary, how about what happen? Una not fet for the party. Una party this, now una papa them party, una uncle them party. So una please, now go quick one, I go take waiting. Now go take salary. Then even forget for do the other procedures them for let them know say they supposed for them at the role. So let we see what thing saying. Then say the PS come and say of the 201 staff, 32 are not staff. Listen, 32 are not staff of the ministry, and that the names of a total of 171 staff were inadvertently omitted. 201 staff. So for make them go inside the nominal payroll, yeah, they make sure say they just by mistake also, they just pull them na the payroll. They not even know waiting they go on with regards to that particular side. Let we see now waiting the Auditor General comment on that particular thing. Then the Auditor General in your comment, he said during verification, a list containing the names of 32 staff was submitted as not being part of the Ministry of Health and Sanitation without any justification why their names were in the ministry payroll. Additionally, so let's take a first. You see the thing, So then 32 then the way they say no to staff. So wait, if they're not to staff, how comes the name come inside the payroll 32? How comes? They're not to staff na the ministry, but the name go directly inside the payroll. Waiting at the means, whose kind magic where they use for go inside the payroll? They say additionally, evidence of the updated nominal roll was not submitted during verification. Rather, a list of 174 staff instead of 171, as stated in the management response, was submitted. Therefore, the issue remain unresolved. So even the staff the way they get, they even say their mistake for pulling under, they're not even still able to put the inside because they're not supposed for the day. So they just make list, they send and say, nah, they this one. Now, let's see something back here. Now, they even they pay, would not the work again, would have been on the day, then they still pay them. Yeah, let's see something. Then say, payment of salary to former staff. I think after this one, I go drop the rating after this particular one. Then say, the names of 11 staff who have either resigned, retired, died, or been dismissed during the period under review, we are still maintained in the payroll until November 2020. So we're waiting and the same. Then say inside inside the payroll, then find out say names them of 11 staff where they feel say sometimes they don't where them be don't resign, or them be don't retire, or them be don't die, or then sack them during the 2020 or 2019. Then find out say their name still there inside the payroll, and then they pay them. When you name them inside payroll, it means that they pay you until November 2020, and then they receive salary, and they receive a total salary of 85,740,659. Even when they're not there again, they're not the part of the team again. They say this might have resulted in the loss of public funds. We therefore recommended for the removal of these names from the payroll and, where possible, recoveries of amounts paid. Evidence of this must be submitted. You see, eh? You see, eh? You see? Okay, I think I touched something. Oh my God, I don't mistake. Okay, so and they say all and then for submittal. Let's see waiting the official response be. Waiting the ministry say. Then say the PS cam now he say the ministry promptly report all deaths of its personnel to the HRMO for the deletion from the payroll. Oh God. From the deletion of the payroll, and that the Accountant General Department always deduct from deaths, gratuity or end of service benefit of service. So basically, the HRMO, most of the time, now they get back the play. The HRMO and the finance people, and now they can play the reggae. So even when they don't send them, say, okay, then people are don't die, or then people are not there again. The HRMO is still maintaining the left inside it, because what's in the happen? If you get like 85,470,000, where the kind inside, where then people are not they exist again, what's in the happen? Then they make sure say, then put them inside it, and then do things and two, then shape. Then they shape the business. Then go. Yeah? So this is not the thing where they say. So let's see what the Auditor General say. Where we go stop here for today. The Auditor General say evidence of removal of the names of the 11 staff and deduction from the death gratuity or end of service benefits for staff who continued to receive salary after death and or retirement was not submitted for additional inspection. So even when they say we be don't give them the HRMO for let them remove them thing they also, but yet still they're not able to present a date a substantive backup document or evidence for sure say yes, we be don't tell them about this thing. But this is not the thing where they happen, and at the regular this way they happen. Okay, I ask you one simple thing before ever I go. Just want to ask you simple thing. You think say this particular thing where we do so this night it be useful based on also will come out. We start from the kind way how people and the suffer. Then you look now how the government they spend money per the young people them for send them go overseas for treatment. And not tap though. You come back say the government, even the one they waiting for management, then the criminal and back put the young family them na pay voucher where they not pay payroll where they not supposed for day, then they're not able for, then they take free money just like that. You think say all of this very useful? You think say we for continue with them in another edition, in subsequent edition, then follow just the look with them on them, even if not for just can't keep company, not a normal we had program, but low just to see how we go and small. You think say useful? Please last year I'm down in the comment section so we go know how for strategize and see. Say we for come back, maybe we can just come like ambush. We know we get regular time. We could just say, okay, we don't read this part, we don't understand them. Let we come back and just come break them down to people, make them understand everything they happen. You think say okay? Hey, Gajiko, they are big lay not. Okay, so una really want for let we continue. Now watch YouTube. Yes, Sarah, extremely useful. Okay. Oh yes, very much so useful. Amina, please do ya. Okay, Awaka no. Amina's mother. We have to manage. Okay. Let's see. Yes. Okay. Of course, okay. So I think so. Yes. Okay. So I think say we go to come with them one time. Let we see what in the happen. By the way, we try for see something. They say all work cannot play make Jack a dull boy. If Leon Star actually they play, we want for make sure say if we get feed, we will get for the follow the Nations Cup. Yeah. If that be the case, we get for the some programs then they will not get for the come to you, rather we'll get for the bring the games them to you. Yeah, so please stay tuned and see. That day self will not get scheduled because we not get right to that day, but we will see if at all we will able to do that day for you. Okay, thank you very much. We appreciate Tuna. Thank you very much. We appreciate Tuna for where Una don't join me today. So Mama Cole, Olufemi Claudius Cole. Mama Cole, the Iron Lady of Corp. Thank you very much, Ma, for we join me inside the program today. So we go actually the camera one time for we can talk to Una about then different things there. So at least it's fine for we young people them they understand. But because no talking true, go camera, then people are then they'll fire we all. I shamelessly, no be honest in this point. Shamelessly, I we caretaker. They call a Yampi parent convention. Then delegate conference say they anyampi them. But I shock and say, what? Thief man they are a thief. So for God's sake, who do for believe now? If you of all where they say you gonna people country, una falsify receipt, you people and they say no, you not get ANPAM budget business, but the scope. Yeah, they can't tell we say anything they do in consultation with you. But you they can be na public, they are a thief, but we country shame not there again. Shame no day. Because me I'd expect a matter be of all for shame, not for the active man by this hour. But still, until I know, if in Pekin, where they na ACC don't come and tell me, this na mere Auditor General, I call it opinion. So what do you expect? You don't give him Papa scope for do anything one for do. So pa, thief money, all a thief, now who that we for believe. Now the wrong side life, we dey live so. Anyway, I want to tell Una thank you. Thank you very much for joining me inside the program today. Well, until we meet again inside another beautiful edition of the program we had, I want to say God bless we all, and please continue for what we had, and always the like, share, and comment. You if we not like, share, and comment, we appreciate you so much. Okay. Until we meet again inside another beautiful edition of this program, I want to say, let God bless we all. Because me caretaker, me uncle, ala thief, or I call people le anyampi nabo. So una let me listen to this song and enjoy them. Una good morning, good afternoon, and good night. Bye.
Papa, you been tell we say that we trust the process, but man, let's call out the progress of the process. Wearing suit and tie, man dirty character. Thief man they all a thief, now the system matter. Whoa, yeah. Papa, you been tell we say make we trust the process, but man, let's call out the progress of the process. Wearing suit and tie, man dirty character. Thief man they all a thief, now the system batter. Rasta man, me know every cock and bull, me represent green, white and blue. That's what me have to do. Then meet the water dirty, then awake make it settle, and then jump inside, then dirty and more. Thief man they all a thief, now the system batter. Salon they go bien. Who that now we go believe, oh, wrong side life, we dey live so. I say now the capside life, we dey live, oh. I say now the wrong side life, we dey live so, eh. It's just a capside life, we dey live now, yeah. Oh now, whoa, yeah. Papa, you been tell we say, make we trust the process, but man, let's call out the progress of the process. Wearing suit and tie, fantastic character. Thief man they all a thief, now the system batter. Rastaman, me know every cock and boot, me represent white and blue. That's what me have to do. When I meet the water dirty, you know, make it settle and then you jump inside. You dirty and more. Tip man they are a thief. Now the system batter salon they go be head. Who that now we go believe, oh, wrong side life we dey live. Sorry say na sana say na sorry yeah. Wrong side life we dey live so. Why? Oh now. Wrong side life we dey live so. I say na the cap side life we dey live, you know. Yeah, man. Real wrong side life, you know. So frustrating, you know. When you hope say things should be better and then you see some funny, nasty things happening, you know, that continues to render the country backward. It's frustrating. You know, that's why sometimes some of us sing songs of this nature to see how much we can educate the masses and really try to make people have a positive mindset, because sometimes we blame the politicians, but we the people have the problem, because we celebrate the criminals, and when you celebrate criminals, what else do you expect? They reinforce the behavior, they think what they are doing is good, it's legitimate. So we the people sometimes have the problem. We have the problem, you know. We have the problem, and we need to stop celebrating criminals in governance. And until we stop celebrating criminals in governance, we will not come out from this mess up that we are into. Thank you, guys.
Yes, subscribe. You always dey watch we program them, but you not subscribe yet to the channel. All wetin you get for do, press this red subscribe button, and then you come over here and press this bell. So the bell option, press this one with all. It don't done. It no get for cost you anything. When you do this, na sign for show say you dey support we for make we do more. Thank you for we your help we for share this program. Yeah, God bless you.